What an extraordinary turn of events. Last night, Prime Minister Scott Morrison went into damage control amid growing concern over the efficacy of our COVID vaccines and the dangers that Australians may face. The federal government issued a blunt but rather sober warning that Australians under 50 should refrain from using the AstraZeneca vaccine. The move, you've got to say, can be seen as an admission that the vaccine is not as safe as the government would want us to believe. Australians must now be pondering just how safe are the COVID vaccines on offer. The AstraZeneca vaccine must now be questionable, and Australians are being asked to place blind faith in what appears to be the unproven science of the COVID vaccines. Now, there's got to be a moral obligation the government must adopt, and that's before asking its fellow Australians to line up as human guinea pigs. No matter how the Prime Minister manages to spin this, the backflip over the AstraZeneca vaccine and all the COVID vaccines has become questionable, especially over the last few days. Only last week, we saw news break of a 44-year-old Melbourne man's hospitalisation following the administration of the AstraZeneca vaccine. Australians were assured at the time by the Chief Medical Officer Paul Kelly and Professor Michael Kidd and the TGA that the AstraZeneca vaccine was safe. No links to clotting, they advised. That was the advice at the time. Well, how wrong were they? And more importantly, how did they get it so wrong? Now, it's got to be the only way you can describe this, an extraordinary turn of events. The government has backflipped, and it's warning Australians to opt for the Pfizer vaccine. They've accepted new medical advice that contradicts the previous advice. It's got to be a condemnation of a program the government and Big Pharma have told us is safe. It turns out they probably aren't at the moment. The Prime Minister's words not only bring into question the entire vaccine rollout, but the quality of advice that his government has received from Professor Michael Kidd, the Australian Health Protection Principal Committee, and that provided by the TGA Vaccine Safety Investigation Group. Think about that. It's an indictment on Kidd, the TGA and Skerritt. And it's a question that really warrants answers. And those answers have got to come soon. It was only several days ago that Australians were told conclusively there was no cause and effect relationship between COVID-19 vaccination and blood clotting. So, what's changed since Saturday? Why has the government suddenly issued a blunt warning to Australians under 50 not to have the AstraZeneca vaccine? And what does it say to Australians over the age of 50? Are their lives less valuable? We at TheInformer have been rather balanced, I think, in our reporting of the COVID vaccine program and the efficacy of both the AstraZeneca and the Pfizer vaccines. Other media outlets, as we've seen, have chosen to run a somewhat different narrative that has been seen, I suppose, to act as a cheerleader for the COVID vaccine rollout rather than actually ask questions. Now, we've been pretty clear from the start. Vaccines are extremely important in the fight against the eradication of disease. But the science must be right. The development of the polio and the diphtheria vaccines in the past were high-class examples of quality vaccines that the medical system had produced, and the science behind them was 100% on point. But we have also stated that the COVID vaccines, in their current form, and the science behind them, as well as the pace with which they've been developed, are unproven. Our decision to question and to probe, I think, has been the right one. Australia must be careful when buying into a program that could harm every Australian. The move to hasten the rollout of a COVID vaccine program is concerning. This new evidence says people around the world who have been administered with the AstraZeneca vaccine have presented with identical problems. Now, that's far from coincidence. Vaccines must be tested properly and must be produced with the right science. Australians, all Australians, and anyone else for that matter, should be treated in the right way, not as test cases for vaccines whose efficacy is in question. Australians must have the right to seek alternative treatments in consultation with their GPs. And GPs should not be controlled and paralysed with fear because the government refuses to acknowledge alternative treatments like ivermectin that we've spoken about in the past. It's a legitimate conversation that must and should be had rather than be told by the very same medical experts that the AstraZeneca and Pfizer vaccines are safe. Well, those very same credible experts who the government has held in such high regard have proven to be wrong, and their credibility now appears to be in tatters.